Hello, my name is Erin Cox, physiotherapist. Today I just want to talk to you a little bit about the biomechanics at the elbow joint. Keep in mind the elbow consists of the humeral ulnar joint, the humeral radial joint, as well as the proximal radial ulnar joint. We'll just look at the humeral ulnar and first. So the humeral ulnar, keep in mind that the ulna is on the medial side of the elbow. And what we have here in the form of the articular surfaces is the ulna sort of cups. It's like a bowl. And in the AP direction, it's going to be a concave surface. But then when we want to look at it, we're going to talk about sort of the bottom of our bowl in this direction here. Because when we want to talk about tractioning, we want a traction perpendicular to the joint surfaces. So if I want a traction, it's going to go in that direction there. But if we want to look more at mobilizing the joint, well, then I'm going to go more in that direction. So I always think about, if I'm in a place like I would be if I were going to mobilize, then the ulnar side is here. So if I want to do a mobilizing, I think about my bowl and the bottom of it, and the surface is at about 30 degrees anterior to the ulna. So if I want to do an anterior glide, I want to do it in this direction. Now, if I want to aid flexion, I want to do an anterior glide, but that joint surface stays the same no matter where I am in my flexion range. So if I want to do it more from this position here, I'm going to glide more in this direction, more anterolaterally. But as we go around and go more toward flexion, and I want to do more of an anterior glide, then can I bring like this and go more in this direction in an anterior superior way to help my flexion. Same thing if I want to look at for the opposite, if I want to help extension, I'm still like this, but now I need to go more in the direction of this way. So if my axis on the ulnar side is like this, I need to go more this way to help extension. So maybe I'll do something posteriorly and also superiorly going this way. And as we go further down, the same thing, that axis is not going to change, it's going to follow. Different than the radial humeral, the humeral radial, the joint surface here is actually perpendicular to the long axis of the bone. So if I want a traction, I can just pull along the long axis of the radius. And if I want to do an anterior glide, well, it would be perpendicular to the long axis of the bone anterior there, or I could do the posterior, anterior posterior to the radius. If we look at the proximal radial ulnar joint, the radial ulnar joints are going to be more for pronation and supination. So we have the alar ligament, and we also have supinator coming around like this. Now, the joint surfaces, because the radius is sitting just anterior, well, the joint surface here now is not particularly in the frontal plane. It's going to be angled a little bit like this. So I don't know if you can see that here. So instead of being completely in a frontal plane, but the joint surface is a little bit angled like that, which means when I go to do my mobilizations, if they're in this position like this, my surface is not completely vertical, it's not completely horizontal, but it's at a bit of an angle. So if I want to, because this is a convex surface on concave, if I want to glide, if I want to aid pronation, remember this is going to roll posteriorly, so I want to do a posterior glide. So I would come in here, stabilize my ulna, and I want to roll this way and posterior lateral glide because the joint surface is in this position. And conversely, if I want to help supination, then I need to do an anteromedial glide going up more in this direction here. I hope that helps you in your biomechanics. Thank you.